All right, for my presentation, I chose occupational therapy. And why occupational therapy? Well, in high school, I was in cross country, and I was always getting stress fractures and getting injured, so I'd need to go and see physical therapists and stuff, and then because I was injured, I would like lift and hit the gym and stuff because I was bored, and then I'd get injured that way. Saw occupational therapist for my hand. Like I was just always, I guess, I was always in there, and I kind of just like the atmosphere, like some healthcare professions, it seems so like intense, like surgery and this and that. But like occupational therapy, physical therapy, it just seems more laid back, and you're just like slowly like just helping people, kind of just work towards like bettering themselves. And I'm very interested in that. And my thesis is occupational therapists play a critical role in improving quality of life by helping individuals regain the skills needed for work and independence. And here is kind of a brief overview of the presentation. So we'll be going through the roles and kind of understanding like what the mission and responsibilities and like the day-to-day like kind of life and impact of an occupational therapist are. Also the educational path, all the like the licensing requirements, degrees and stuff like that. And then the career outlook, like exploring job prospects, salary expectations, and future opportunities. All right, what the field of occupational therapy involves. So mainly occupational therapy is going to involve helping people to like recover, maintain skills needed for daily living and working, and their main mission is to increase a person's independence and overall quality of life. Like you're going to get a patient like coming in like they can't do like daily activities, and you're going to need to like work and strengthen them or help them like adapt so that they can have a better quality of life. And that's like restoring the function, obviously promoting independence so that they don't always need to come and get help or rely on other people, and then improve their quality of life mainly. Yeah. And then the work environment. So mainly you're going to be in, obviously, hospitals or like physical therapy centers, rehabilitation centers, sometimes in schools and nursing homes, actually. And yeah, obviously working mostly indoors, though sometimes it's like traveling in some occasions. Like it's very rare, though. And yeah. And when I say traveling, I mean like, going to home visits maybe for people who just can't get in, or like maybe like don't have like transportation, or who are like really having a problem. You just go and help them with that. All right, and a day in the life of an OT. So you're going to be doing a lot of collaboration with patients, families, doctors, nurses, and PTs, and just really trying to like focus in on making their program and their like exercises and progress like more personal to them for the best results. So yeah, you're going to be using therapeutic exercises and like describing them to people, helping them like understand and like so that they can go home and then replicate these same exercises so that they can keep getting better. You're going to be evaluating patient abilities, and you're going to create personalized treatment plans and teach patients like adaptive techniques for their daily tasks. If full rehabilitation isn't like on the table, you're going to teach them how to adapt them so that they can have a better like quality of living. And the main patients you're going to be working with are obviously patients who are recovering from injuries or surgeries, and another big one is elderly patients, being that they're needing help sometimes, and stroke victims are another one, children with developmental delays also, and other healthcare professionals. All right, the educational path to becoming an occupational therapist. You need a strong academic background to understand human function and design effective evidence-based interventions to treat patients. And so those common kind of courses, prerequisites, are going to be anatomy, physiology, psychology, statistics. Another one I think is biology and psychology, if I didn't say that. Yeah, but those are kind of the common prerequisite courses, obviously, to like understand the human body, and also mental too. That's a big part of occupational therapy, is kind of knowing psychology and always kind of being positive and motivating your patients. You're also going to need a master's degree in occupational therapy, and that's kind of the standard. You can get your doctorate, but that's just not the standard, I guess. And then you're going to need to pass the NBCOT exam and get state licensure, which I think I'm going to go over in a second. Yeah, so first you're going to want to graduate with that master's or doctoral degree, then pass the NBCOT exam, and then get licensed. So it's just like kind of straightforward here. Like everyone's got to do it going into this profession. And critical to this journey is completing over 1,000 hours of supervised field work, like clinicals and job shadows and stuff. And one other thing with the education that not many people realize is that like every year or so, I'm not 100% sure what it is for OT specifically, but you're going to need to like complete like a continuing education exam online or something just to keep your license like up to date. And here's kind of the professional outlook of the career of occupational therapy. So the demand for OTs is actually going up due to aging population and more focus on rehabilitation and long-term care. Another factor is people are actually becoming more aware of the services that you can actually go in and get help from a occupational therapist or whatever. And your salary, when I was doing like research, it's kind of all over the place. Like entry level 60 to top end 90K, that's top end. But the median salary is about 93,000. So yeah, that's pretty good, I'd say. And another little kind of fact about occupational therapy is that it's growing much faster than average, so about 10 to 12% growth over 10 years for the job growth. And here are the main skills that you're going to need when being an OT. So you're going to need good communication skills, obviously, good empathy and patience. This is a big one, positivity. When I was a job shadowing physical therapist, I think last year, like a lot of these older patients just have absolutely no motivation, I guess, which is kind of sad. And you just have to be really like positive with them. Like you kind of always got to like come to work with a smile on your face for your patients, just so that they kind of feel good, they feel positive, and they want to get done. They see a little bit of hope and are motivated to actually work at the exercises, because I guess it's like what you can do as a occupational therapist can only like go so far with the patient. They need to be doing like their stuff, they need to be doing their exercises, and they need to be trying. So really being motivating is like a huge part of being an occupational therapist, in my opinion. And some other essential skills, obviously problem solving and physical stamina. You need physical stamina because you're going to be kind of demonstrating these, exercises, and you're going to be like doing kind of a lot of work, moving around, kind of like orienting patients and stuff, for lack of a better term. And, the best part is helping patients regain independence and like witnessing like improvements in their day-to-day lives. Like they come in at the beginning, they're kind of down, and then by the end they're like kind of happy and like doing their own thing, and like and then talking about some of the biggest challenges, mainly kind of what I talked about earlier with supporting patients through like a tough spot in their life, helping them go through frustration and slowly recover. All right, to conclude, here's some takeaways from occupational therapy. It's a vital profession. It's evidence-based field that helps individuals regain essential daily living skills, merging science with compassionate service. So it's kind of both sides of that I actually really like, I was interested into anatomy and stuff, and I also like helping people out. It is kind of a rigorous path. You know, you need to get your master's degree and extensive field work, get your licensing, and not to mention like 1,000 plus hours. You know, doing clinicals and job shadows. So yeah, basically, once all your hard work is done in college and passing all those exams and getting your license, it offers a very good job growth and competitive salaries. Like, you're going to be pretty well off, I'd say, as an individual with the salary that you're going to be making it a good career choice. All right, and here are some of the final thoughts on occupational therapy. It's more than just like giving people exercises and leading them through like routines and stuff to better their bodies, but it's about encouraging people who have kind of lost hope and helping them get back to daily activities that they were probably missing out on.